All new.
Germs are everywhere.
Are you picking up more than dinner at your local market?
That's one of the biggest ways you're going to get food poisoning.
Will a vacation make you sick?
You know what the dirtiest thing in the hotel room is?
Plus, restaurants, hospitals, are they really safe?
I was literally being eaten alive.
And
4 things that you handle every single day in your life that are filthy.
on the doctors.
When you're sick or need immediate medical attention, the hospital is the best place to be. Or is it? We're about to set the record straight about what you may have heard about hospitals when we come back.
MRSA is often described as a drug-resistant superbug.
Medication errors are actually more common than most people realize.
We're talking about hidden health hazards and the 5 places that may be making you sick. Coming in at number 2 on our list, hospitals. Sad to say it, but in most circumstances, the hospital is exactly where you want to be when you're sick. However, there are some health risks that we want to make you aware of.
Health investigators are trying to solve a medical mystery at a Yonkers hospital.
5 baby boys and 2 baby girls have been diagnosed with MRSA, the drug-resistant staph infection that is rapidly spreading through the population.
We're going under the operating assumption that it came from here in some way.
MRSA is often described as a drug-resistant superbug.
Medication errors are actually more common than most people realize.
If a patient receives a medication that they shouldn't receive because of a problem with a sound-alike name or look-alike name, it could be very dangerous.
When mistakes do happen, pharmacists say it's typically because a prescription is tough to read or a verbal order is misunderstood.
Her family calls it a botched surgery on a spinal disc. Professional ice skater Ann Ervelina said the surgeon, during surgery, he had become disoriented.
I didn't know that I'd come home and I'd be in a hospital bed in my living room.
Ms. Ervelino says the doctor told her she would probably never skate again.
And then he left for his honeymoon.
So hospitals overall, very safe places. We have to talk about certain things though. Secondary infections are common in hospitals because, let's face it,
that's where sick people go. Floating around, and you try not to get them passed from patient to patient, but it sometimes happens. It's the 4th leading cause of death in the U.S.
And you have to be aware of that, but people in the hospital are sick. They're the ones whose immune systems may be compromised, and other people are there for infections. You have healthcare workers that, in spite of trying to do everything they can, you're always going to get a certain number of hospital
all those long
infections.
shifts, and the people are getting tired and overworked.
I mean, just like with
errors.
With surgery, no matter you prep, you drape the same way, you glove the same way,
but still so many precautions.
But still, there's a certain number, a small number of infections that do occur.
Well, that's why you give prophylactic antibiotics, because even after all those, we've known with studies, there's still a chance of infection.
And I don't care who you are, if something goes bad in the hospital at 4 a.m., probably not going to be quite the same response as at 4 p.m. Because, number one, there's fewer staff, and number 2, anyone operating or working at 4 a.m. is sometimes going to be a little less, I hate to say it, but awake.
Yeah. Right. And that's why we as doctors actually know when to do certain procedures and things like that. If there's, a possibility that an emergency might occur, you're not going to do them, late at night unless you absolutely have to.
That's why elective procedures are done during the day. But last but not least, medication errors. I have to say that with electronic systems as they are, a much improved system. I never write out a prescription anymore. Which is good, because my handwriting's bad. It's all electronic.
But there's still almost 500,000 medication errors back in last year.
But I will say, all of us working in hospitals, we try our damnedest to make sure none of this happens. But where there are sick people, things happen like this. 2 years ago, Alicia went in for a routine surgery. Everything went well, or so she thought.
My life is never going to be the same. I contracted necrotizing fasciitis, which is commonly known as man-eating flesh disease. My 2-day hospital stay turned into 2 months, and it's been over 2 years, and I'm still healing. The nurse had come for the afternoon dressing check, and she lifted up the gauze, My mother looked really closely and she said, wait a minute, there's a black dot on her stomach. Not on her, in her skin. And that wasn't there this morning. So we need the doctor back here right away. Over the next 2 or 3 days, the pustule started to grow, and then there became boils and rotted flesh all over my stomach. Right before my eyes, my stomach was rotting like a bad piece of meat. I was literally being eaten alive. The worst day was the day that my surgeon came to me and he said, Alicia, I need to just prepare you. Tomorrow, you could wake up without your leg. I firmly believe I got this infection in the hospital. I went in a healthy individual, never been sick a day in my life, and I got something so rare and deadly. I want everyone watching this to take away, there's no such thing as a routine procedure.
Alicia, welcome to the show.
Yeah, thank you.
It's hard for you to even watch that.
It is. It is. You know, I'm still healing. I'm just now starting physical therapy. And we have to be really careful because when I start to do too much movement, the new skin, I get little tears and pinholes. And then if we don't slow it down, then they tear and get even bigger. So I kind of have to look at it almost as a science project. You know, it's not me. We just got to take care of this. I got to keep moving, got to eat right, take my vitamins, do what the doctors tell me, and just keep moving forward.
And did you learn anything from this entire experience?
Oh, yes. Oh, yes. I have learned so much. The first thing is, as I said on the tape, there's no such thing as a routine procedure. Your skin is an organ, and when that skin is breached, even for surgery, it has the potential for bacteria and germs to get in. So you need to be aware of that risk when you go into the hospital.
And that can be despite any and every precaution
Absolutely.
that the surgeon takes.
Absolutely. You know, things happen, you know, and so you have to be careful. One of the things that I learned, speak up and don't be afraid. Most doctors and nurses, they wash their hands. It's part of their training. But sometimes they get busy and they'll come into your room. Go ahead and say, excuse me, could you wash your hands? When your visitors come, have them immediately wash their hands before they hug you, before they do anything. And avoid sitting on your hospital bed. Because when they come in, they've been sitting in the car seat, they've been riding on public transportation, they maybe took a cab. All of those germs that are on the bottom of their pants or their skirt or their jacket are now being transferred to your bed in the hospital.
And thank you so much for sharing your story.
Yes. Those are some great points that she made, and
especially
I think we've all.
If you see anything out of the ordinary that you're, unclear about, you should always ask.
And the takeaway is,
although rare, this truly is flesh-eating, necrotizing fasciitis. We hear of that very rare, but once it starts, like in your case.
And I think a great takeaway, Drew, is not only once it starts, it's tough to stop, but anytime you're having an elective procedure done, it's not without risk. So arm yourself with as much information as possible.
But a good point to bathe with antibacterial soap prior to procedures. If somebody knows that they've had a staph infection previously, that you're probably at higher risk, you may be a carrier of staph, so you should do things ahead of time a little different.
The takeaway also, though, is by far the great number of elective procedures go off without a hitch. That's the beauty of it.
Most of them are fine.
Coming up next, have you been worried about your own health hazard? We'll be answering all your questions plus a whole lot more coming up after the break.